So next we have the discussion about the post-operative confusion. So a 68-year-old man becomes acutely confused 3 days after radical prostatectomy. So whenever you encounter such a scenario, always try to establish that what is the state of the patient. So we are having the patient at the third post-operative day. So now the patient is having fever and his urinary catheter bag has cloudy urine. So what is going to be the most likely cause for this pathology? Would it be a pre-existing dementia, delirium secondary to chest infection, secondary to reactionary hemorrhage, or delirium secondary to UTI, or the patient has developed stroke? So in our scenario, there is delirium which will be secondary to the urinary tract infection. So what are the giveaways? So the cloudy urine post urological surgery is a giveaway for a catheter associated urinary tract infection. So acute delirium in early post-operative period is always precipitated by some acute medical cause. So that is your principle from this statement, that you have to identify that acute medical cause that is high yield. So it could be infection, hypoxia, it could be because of pain, it could be because of drugs, and even some metabolic derangement. Now, following a urological surgery with an indwelling catheter with a cloudy urine, it is 100% sure that the patient has developed catheter associated UTI until proven otherwise. Now, the important thing is that dementia is a risk factor for delirium, but it will not develop in such an acute scenario. So chest infection can be a reason between first to third day, but we have the patient on the third day. So for that chest infection, there will also be association of some respiratory signs as well, that the patient can have increase in the respiratory rate. The patient will have a decrease in the oxygen saturation, and the patient can be tachypneic as well. Hemorrhage will result into hemodynamic instability, and the patient will have a decrease in the blood pressure, an increase in the heart rate, a decrease in the urine output, or even a decrease in the GCS as well. Now, stroke is very less likely because neither there are certain risk factors nor certain other contexts for stroke being the reason for this scenario. Post operative delirium, what are the causes behind it? So, the mnemonic for that is pinch. So, they could be associated with pain, infection, malnutrition, constipation, hydration, medication, or environmental factors. Now, cloudy urine with an indwelling catheter and the patient being febrile will be catheter associated urinary tract infection. And if that results into features of post-operative delirium, it will be one of the etiology for that. For that, we have to treat it with the antibiotics. Now, dementia is a risk factor for delirium, but it will not be one of the factors resulting into acute confusion. So always investigate. And how can we investigate? We can use the midstream urine samples. We can send for the blood cultures, ECG, ABG, review the drug chart, and check for the metabolic derangement. Delirium in elderly patient has a poor prognosis and it is associated with increased morbidity and mortality. For that reason, you have to reach your diagnosis that what is the cause, and you have to treat accordingly, because otherwise it will increase the morbidity and mortality.